Good afternoon. Myself, Dr. Vinayak Garje, Joint Preservation and Arthroscopy Surgeon at Ranka Hospital. Friends, we'll discuss today what is basically a total knee replacement and how it is to be done. What are the frequently asked questions by the patients about total knee replacements and their problems? What are their concerns about? We'll just discuss about in brief what exactly how we do the TCAS and everything. Before starting, I'll just let you know what is basically a TCAR. So what is knee? Before going for a total knee replacement, we should know what exactly is a knee. This is a knee model, knee anatomy model. This knee joint is basically a joint made up of three joints. It's a complex joint. So there is a joint in front of the knee, there is a joint inside of the knee and outside of the knee. So there is the three joints basically comprising of this single knee joint. So what basically total knee replacement is? Whenever the joints are getting eroded, whenever the joints are getting totally burn out with the cartilage and everything, so we go for this procedure called as total knee replacement. In total knee replacement, what we do is basically we are replacing all three joints. It's inside joint, outside joint, and the basically in front of the joint. So what we call it is a medial joint, lateral joint, and patellofemoral joint. So we are replacing all three joints, and after that, what we call it as a like total knee replacement. What are the frequently asked questions about the knee replacement? Whenever the patient comes to us, they are asking, ki, "Am I too old for this getting to knee replacement?" Yeah, this is a genuine question. So everyone asking, ki, at what age I am supposed to get knee replacement? Am I too old? At the age of 80, someone asking you whether can I go for a total knee replacement? Yes, you can go for the knee replacement. Yeah, for sure. Before getting for knee surgery, you should get thoroughly checked with your all medical fitness and everything. If you're fit from all these things, medical point of view, from anesthesia point of view, for sure you can go for the total knee replacement surgery. What are the age criteria? So, per se, there are no age criteria. The knee replacement we generally do is whenever we do have a knee pain and your cartilage is totally worn out. So, in these cases, we generally go for the total knee replacement. Another next most common question asked by patient, which anesthesia am I going to get? Am I going to get the general anesthesia or like just a local anesthesia? No, normally it's never been done in local anesthesia. It's only in what we call as a spinal anesthesia. From below waist, you are basically getting anesthetized for this bilateral or unilateral total knee replacement, whatever we are doing. What are the what is the time required to get this surgery done? So normally, for one knee to get operated, is time required is around 2 hours. If you are going for both knee at the same sitting, so time required is around 4 hours to 5 hours. After the surgery done, patient generally have the concern whether I'm gonna get the pain or it is bearable for me. Yeah, normally what we are doing is doing before anesthesia. This is called as spinal epidural anesthesia. Once the surgery is done, we are keeping this epidural catheter inside there only, so we can give the on a routine basis we can give the top ups for the anesthesia. So your post-op period will be totally painless. So we don't have to worry about the pain in a post-op thing. After surgery, should you do you need to go for a physiotherapy? Yeah, obviously that is the foremost part. 50% part is the surgery, 50% part is the physiotherapy part. So whatever the type of good type of surgery done, the major part is role being played by basically rehabilitations. How good you are doing the physiotherapy, that is totally important. When generally you do walk after surgery, yes, immediately next day we start basically on your ambulations immediately after surgery, or maybe like after 12 hours or 24 hours. Generally, physiotherapy, how many months should I take it after knee surgery? Yeah, that is a very common question. Normally, at least 2 to 3 months after surgery it is a very crucial period to get yourself come to the normalcy. After doing TKR surgery, you're supposed to go through the various type of rehabilitation programs. So, immediately after the surgery, we start ambulating with you on a walker. Gradually, within 3 to 4 weeks, we wean off with a walker and make you walk on yourself. Stair climbing down. On these things, we can start gradually as per the patient's tolerance. But these strengthening exercises and all this protocol is to be followed for at least 2 to 3 months, and after that, your knees can be working like as you were doing prior to your surgery. The next question generally patients do ask, should I go bilateral knee replacement or a single knee replacement at the same sitting? What should I choose? Should I go for both or single? It's a confusion. Yes. There are basically bilateral knees TKR done as well as basically a single knee replacement also done in the same sitting. But are you fit to go for a bilateral or not? How to decide? Yes. So this part is generally being taken care by the your treating orthopedician whether to go for a bilateral or unilateral. So for immediately on the same sitting, if you are planning to go for a bilateral, which things are must to be taken in consideration prior to it. So your health first part that has to be taken care of. So from anesthesia point of view, what we do see is your how is your health condition from cardiac point of view, how is your respiratory conditions. Are you basically diabetic? Are you on hypertension medications? Are you on any thyroid medications? So after seeing all these medical conditions or what are the comorbidities you are associated with, taken into consideration, we can plan whether to go for a bilateral or unilateral. The next most common question asked by the patients is like, should I get the high flexion knee? So this is very new advances what do we are seeing in total knee replacement. So this is called as high flexion knee. So according to the high flexion knee, if you are like very much into the squatting, kneeling down, these positions. So in these cases, we can go for the high flexion knee, and with this, we can allow you to go for like squatting, kneeling, sitting cross-legged. But these implants are not even tried up to full. So the recommendation is not to do basically this squatting, kneeling down, and sitting cross-legged things until unless it is necessary. Otherwise, high flexion knee, whether they are really going into the any complication in loosening of the implants or not, it's still under a trial thing. So once all these things are clear, we can come with a newer ideas and newer things whether we can do these things or not. So another question frequently being asked: what is unicondylar knee replacement, and what is the difference between total knee replacement and unicondylar knee replacement? So, what I told you earlier, so knee joint is basically made up of three joints. This is called as a patellofemoral joint, this is medial joint line, and this is the lateral joint line. So, in India, over the time of maximum total knee replacement been done are for basically osteoarthritis of knee because of degeneration and because of aging process. So, most commonly affected joint is your medial joint line. So, this is the medial joint line. So, this is generally affected. So, if your only medial joint line is affected, your lateral joint line is good, your cartilage is good, your even patella femoral joint line is also good. In that cases, we can think of doing this. It's called as unicondylar knee replacement. So, what exactly we do in unicondylar knee replacement? So, in unicondylar knee replacement, what we are doing is basically, so this is your knee model. So this is your patella. This is the extensor apparatus. So this is your medial joint line. So what we are doing in these cases, we are just keeping your lateral joint line as it is. We are preserving this cartilage. We are preserving your patellofemoral cartilage. We are utilizing the same. The only medial joint line has been replaced. So we are just putting the implants in the medial joint line. So what are the benefits of doing unicondylar knee replacement over the total knee replacement? Okay, so the recovery after surgery is very earlier in unicondylar knee as expected with your total knee replacement. Pain component, it's obviously lesser than what it is in total knee replacement. Your rehabilitation process, your physiotherapy in post-op time, everything is in a lesser time.